Hello friends, welcome back to my channel. This video is my 20th notebook of pharmacology subject for Neet PG exam. First case, a bronchial asthma patient on inhalational steroids had white patchy lesions on tongue and buccal mucosa. Diagnosis is oral candidiasis. Drug of choice is clotrimazole, which is a topical imidazole. Next is griseofulvin. Griseofulvin is a drug of choice for tinea capitis in children. Griseofulvin inhibits microtubule assembly. Next is terbinafine. Terbinafine inhibits epoxidation of fungal squalene that reduces ergosterol biosynthesis. Terbinafine is used in treating nail onychomycosis as well as tinea capitis. Flucytosine inhibits fungal DNA synthesis. Flucytosine is used in combination with amphotericin B for cryptococcal meningitis. Dinoprostone is PGE2 analog. It is used in induction of labor, atony treatment, cervical ripening. Dinoprostone is avoided in patients with history of asthma, MI. Major side effects of dinoprostone include uterine hyperstimulation. Ergot derivatives are given as IM. It is used in control of postpartum uterine bleeding. Ergot derivatives are effective within 1 to 5 minutes. Ergot derivatives are given at the time of placenta delivery. Next case is pregnant woman with history of bronchial asthma in stage 3 of labor. Drugs avoided in treatment of PPH in this mother is carboprost. Carboprost is PGF2 alpha. Carboprost is used to induce second trimester abortions. Carboprost is used to control PPH. Bronchoconstriction is present when given with carboprost. Oxytocin given as IV route. It is used to treat PPH. It is the first line drug. Oxytocin lead to hypotension and reflex tachycardia. Next is a patient with previous history of MI and ventricular arrhythmia is on treatment. He has fatigue, weight gain, dyspnea, pulmonary fibrosis. The drug for the above side effects is amiodarone. Amiodarone is class 3 antiarrhythmic drug. Other side effects of amiodarone drug is corneal microdeposits, photosensitivity, hypothyroidism, hyperthyroidism. Losartan is an angiotensin receptor blocker, that is ARB, which is used in treatment of hypertension. Side effect of ARB is hyperkalemia. Losartan lower the serum uric acid level in patients with hyperuricemia. Nesiritide, it is a recombinant human brain natriuretic peptide. It is given as IV route. Nesiritide is used in acute decompensated heart failure. Omapatrilat, it is a drug which is used as dual inhibitor of neutral endopeptidase and ACE. Sacubitril is neprilysin inhibitor. Sacubitril along with valsartan decreases mortality in heart failure with decreased ejection fraction. Aspirin is an NSAID. It inhibits the formation of thromboxane A2 by acetylation of COX-1. Atenolol is beta-1 selective antagonist. Atenolol along with a diuretic is given in elderly patients with isolated systolic hypertension. Side effects of atenolol includes bradycardia, fatigue, cold extremities. Next case is a young female took 100 tablets of aspirin. Next step is give sodium bicarbonate in 1 liter of 5% dextrose in water and alkalize urine. Aspirin is a weakly acidic drug, so it is susceptible to ion trapping in urine. Alkalinization of urine is contraindicated in renal failure or if fluid administration may worsen pulmonary edema or congestive heart failure. Spironolactone is a potassium sparing diuretic. Mechanism of spironolactone is it is a competitive inhibitor of mineralocorticoid receptor in late distal tubule and collecting duct of kidneys. Spironolactone is contraindicated in patients with hyperkalemia. Side effects of spironolactone include gynecomastia, impotence, decreased libido. N-acetylcysteine (NAC) is given as an antidote in paracetamol poisoning. NAC replenishes glutathione store in liver. Pralidoxim is given in OP poisoning. Pralidoxim regenerates active acetylcholinesterase. Glucagon is used in beta blocker toxicity. Phentolamine helps in the control of hypertension due to clonidine withdrawal. Next is a case, a chronic smoker on nicotine replacement therapy and clonidine tablets for smoking, the de-addiction. He stopped clonidine tablets and presents with headache now. Diagnosis is rebound hypertension. Clonidine is alpha-2 receptor agonist, centrally acting antihypertensive agent which is used in the treatment of high BP by stimulating presynaptic alpha-2 receptors in vasomotor center in brain system. Clonidine has sympatholytic effect by decreasing norepinephrine. Side effects of clonidine include dry mouth, sedation, impotence, constipation. Next case is patient was given digoxin. He had side effects of nausea and vomiting. Serum concentration of digoxin is 4 mg per deciliter. Plasma therapeutic range is 1 mg per deciliter. Half-life of digoxin is 40 hours. So the question is how long one should wait before resuming treatment. It is 80 hours. 80 hours. Patient had recurrent attacks of gout, started on treatment which inhibited synthesis of uric acid. Symptoms were reduced after therapy. So the question here is which drug was the patient started on? Answer is allopurinol. Allopurinol is a purine antimetabolite. Competitive inhibition happens here, that is competitive inhibition of xanthine oxidase enzyme takes place here. Allopurinol inhibits the conversion of hypoxanthine and xanthine to uric acid, reducing plasma uric acid levels. Metabolite of allopurinol is oxypurinol. Non-competitive inhibition of xanthine oxidase takes place here. Allopurinol is used in the treatment of hyperuricemia in patients with gout and also in patients with hematological malignancies to undergo chemotherapy. Probenecid is a uricosuric agent. Probenecid inhibits organic anion transporter, mainly URAT, in renal tubule. Probenecid is given for chronic gout. Next case is patient who had OP poisoning was given atropine infusion and pralidoxim. After 2 hours, patient had sudden increase in temperature. Likely cause of fever is atropine toxicity. Atropine is a muscarinic receptor antagonist. Atropine competitively blocks the acetylcholine at muscarinic receptors. Organophosphorus are acetylcholinesterase inhibitors. Muscarinic excess code is dumbbells, DUMBBELSS. So the code is dumbbells for muscarinic excess, which includes D for diarrhea, U for urination, M for meiosis, B for bronchospasm, B for bradycardia, E for emesis, L for lacrimation, S for salivation, and the other S for sweating. Muscarinic manifestations are the above told things. Next is nicotinic manifestation, which include twitching of eyelid, tongue, facial muscles. All these leads to paralysis. CNS stimulation causes headache, tremors, ataxia, coma, and death. Next is colchicine. Colchicine is an anti-mitotic drug. It is used in the treatment of acute gout. Colchicine inhibits microtubule and spindle formation. Diclofenac is an NSAID. It inhibits COX-2 enzyme. Side effects of diclofenac include rashes, fluid retention, renal function impairment. Epoetin alpha and darbepoetin alpha, these both are recombinant human erythropoietin. Epoetin alpha and darbepoetin alpha are used in the treatment of anemia associated with AIDS, surgery, carcinoma, chemotherapy. Next is amifostin. It is used in the reduction of nephrotoxicity associated with cisplatin. A patient who has malignancy is on chemotherapy. Platelet count is reduced after previous cycle of chemotherapy. Diagnosis is chemotherapy-induced thrombocytopenia due to non-myeloid malignancies. Treatment is oprelvicin, which is an interleukin-11 analog. Next is filgrastim. Filgrastim is GCSF. It is used in the treatment of severe neutropenia after high dose of cancer chemotherapy. Losartan acts as thromboxane A2 antagonist. Losartan inhibits platelet aggregation. Losartan is competitive angiotensin receptor antagonist. Side effect of losartan is hyperkalemia. Telmisartan dose should be reduced in hepatic failure. Clearance of telmisartan takes place by biliary secretion. Irbesartan is cleared mainly by biliary excretion. Plasma clearance of irbesartan is unaffected by either renal or mild to moderate hepatic insufficiency. Candesartan dose decreased in renal failure. Candesartan, the plasma clearance is by biliary excretion as well as renal elimination. Atropa belladonna, think belladonna as a beautiful woman. So atropine overdose, think the code as hot as hair, mad as hatter, blind as bat, red as beet, dry as bone. This is the code for atropine overdose. So the symptoms and signs showing in atropine overdose are high temperature, confusion, delirium, mydriasis, flushed face, decreased secretions and thirsty. Theophylline is metabolized by the enzyme CYP1A2. Drug interactions of theophylline includes agents that decrease plasma level is phenobarbital, smoking, phenytoin, rifampicin. Drugs that increase theophylline plasma level is OCP, allopurinol, ciprofloxacin. Mechanism of action of tissue plasminogen activator is it enhances fibrin degradation. TPA, that is tissue plasminogen activator, is used in pulmonary embolism with hemodynamic instability, acute MI, acute ischemic stroke. All thrombolytics causes bleeding counteracted by antifibrinolytics, which include aminocaproic acid and tranexamic acid. A male patient who has COPD was given theophylline. Urine output increased following day. This action of drug is mediated by adenosine A1 receptors, which is present in afferent arteriole of glomeruli. When activated, they cause vasoconstriction that reduces GFR and renal blood flow, which decreases urine output. Methyl xanthines include theophylline as well as aminophylline. These both are bronchodilators. Methyl xanthines are used in COPD as well as bronchial asthma. Side effects of theophylline include diuresis, which is due to inhibition of adenosine A1 receptors, cardiac arrhythmia, which is due to inhibition of cardiac PDE3 and antagonism of cardiac A1 receptors, seizures due to central A1 receptor antagonism. Next is therapeutic drug monitoring, or the drugs that narrow therapeutic index are, code is DAT, LAAT, MC. So the drugs that narrow therapeutic index are digoxin, antiarrhythmic, theophylline, lithium, aminoglycoside, antiepileptics, TCA, methotrexate, calcineurin inhibitors. Pharmacological actions of theophylline include inhibits phosphodiesterase, which increases cellular CAMP and cyclic GMP, which causes bronchodilation. Theophylline antagonizes adenosine A1 receptors, which causes bronchodilation. Theophylline increases interleukin 10 release, which causes anti-inflammatory action. Theophylline decrease in gene transcription of pro-inflammatory cytokines. Theophylline promotes apoptosis of granulocytes and also decreases inflammatory load in airways. Metformin is not likely to cause pleural pathology. Metformin belongs to biguanide class of OHA. Metformin acts by stimulation of AMP-dependent protein kinase, that is AMPK. Side effect of metformin includes lactic acidosis, vitamin B12 deficiency, gastrointestinal disturbance. Contraindication of metformin is unstable congestive heart failure, acidosis, GFR less than 30 ml per minute. Bleomycin is an anti-cancer antibiotic. It is used in the treatment for squamous cell carcinoma, Hodgkin's lymphoma. Side effect of bleomycin include mucocutaneous toxicity and pulmonary fibrosis. Nitrofurantoin is an urinary antiseptic. It is used in the treatment of UTI. Nitrofurantoin damages DNA. Side effect of nitrofurantoin is pulmonary fibrosis. Conversion of vitamin K epoxide, which is inactive, to reduced vitamin K, that is active, is by vitamin K epoxide reductase. It is inhibited by warfarin. Factors 2, 7, 9, 10 helps from the conversion of inactive to active by the help of gamma glutamyl carboxylase. Half-life of protein C is 8 hours. Half-life of protein S is 24 hours. Next is a case. Patient with DVT started on new drug. After 2 days presented with purple toe syndrome. The new drug which patient was started was warfarin. Purple toe syndrome is the rare complication of warfarin treatment, which is due to cholesterol microemboli released from atheromatous plaques, which causes arteriolar occlusion. Warfarin should be immediately stopped because it is replaced with oral factor 10A inhibitor, example apixaban. Use of warfarin includes acute DVT, pulmonary embolism, inhibits strokes or systemic embolization in patients with mechanical heart valve. Side effect of warfarin is purple toe syndrome, fetal warfarin syndrome. Fetal warfarin syndrome is hypoplasia of nose, eye socket, hand, bones, and also growth retardation. Therapeutic dose of warfarin is INR range of 2 to 3. Warfarin is metabolized by CYP2C9 enzyme. Anticoagulant function of warfarin. Increased efficacy is by metronidazole, amiodarone, cimetidine, and isoniazid. Reduced efficacy is by OCP, barbiturate, and rifampin. Next is meclizine. It is used for seasickness. Meclizine is a long-acting H1 antihistamic drug. Heparin stimulates antithrombin 3. Side effect of heparin is bleeding and heparin-induced thrombocytopenia. Rivaroxaban is direct inhibitor of factor 10A. Rivaroxaban is used in the treatment of DVT. Side effect of rivaroxaban is hypotension, tachycardia. Dabigatran is direct thrombin inhibitor. Dabigatran inhibits embolism and stroke in patients with atrial fibrillation. Side effect of dabigatran is bleeding and dyspepsia. Reversal agents of anticoagulants are heparin, it is protamine sulfate. Warfarin reversal agent is vitamin K. Rivaroxaban and other oral 10A inhibitors reversal agent is andexanet alpha. Dabigatran reversal agent is idarucizumab. Next is patient on chemotherapy was given an antiemetic. Then he developed acute dystonia, tremors, and bradykinesia. The antiemetic which patient was given was metoclopramide, and the above acute dystonia, tremors, and bradykinesia, these all were the extrapyramidal side effects. Due to antagonist action on dopamine receptors by metoclopramide, there is prokinetic as well as antiemetic reactions. Metoclopramide is used in gastroparesis. Metoclopramide is a dopamine receptor antagonist, 5-HT4 receptor agonist, 5-HT3 antagonist, sensitization for muscarinic receptors on smooth muscles, which results in increased lower esophageal sphincter tone, which stimulates the gastric antral contractions. Ondansetron is 5-HT3 receptor antagonist. Ondansetron is used in the treatment of post-operative and chemotherapy-induced nausea and vomiting. Fat-soluble vitamins are vitamin A, D, E, and K. Young patient who has weight loss medication which acts by fat absorption from food. After few weeks, patient had easy bruising and increased menstrual bleeding. It is due to the deficiency of vitamin K. Vitamin K deficiency is diagnosed on increased prothrombin time or decreased clotting factors. Vitamin K deficiency is treated with parenteral dose of 10 mg followed by 5 mg. Scopolamine is also known as hyoscine. It is muscarinic antagonist. Transdermal patch of scopolamine is used as an antiemetic in motion sickness. Vitamin E deficiency is seen in hemolytic anemia. Vitamin B6, it is a water-soluble vitamin. Drugs that cause vitamin B6 deficiency are isoniazid, OCP, hydralazine, penicillamine. Patient presents with peripheral neuritis, seborrheic dermatitis, glossitis, and convulsions. These all are seen in vitamin B6 deficiency. Convulsions in vitamin B6 deficiency, it is due to decrease in brain GABA levels. Patient who had UTI symptoms was given a drug which causes tendon rupture and arthropathy. The drug is fluoroquinolones. Mechanism of action of fluoroquinolone is DNA gyrase inhibition. Fluoroquinolones inhibit topoisomerase 4 in gram-positive bacteria. Fluoroquinolones are used in the treatment for UTI. It is second-line drug in anti-TB treatment. Fluoroquinolones are avoided in children and pregnant women. Fluoroquinolones side effects are arthralgia, tendon rupture, prolonged QT interval, seizures, delirium. Next is a case. Patient was brought to emergency with history of consumption of 8 tablets of digoxin. On examination, patient was unstable. Heart rate was 56 beats per minute. That means bradycardia. Heart rate is only 56 beats per minute. ECG showed 3rd degree heart block. Next step in treatment of patient is antibody against digoxin, that is Digibin. Digibin is non-immunogenic antibody. It is used in the treatment for cardiotoxicity due to digoxin. It is non-immunogenic because it lacks Fc fragment. Digoxin is used as cardiac glycoside. It is used in the treatment of heart failure. Digoxin controls ventricular rate in atrial fibrillation or atrial flutter. Cardiac manifestation of digitalis toxicity is ventricular tachycardia, partial to complete AV block, severe bradycardia, atrial fibrillation or flutter. Increased risk of digoxin toxicity causes hypokalemia, quinidine, that means the drugs which decrease digoxin elimination, that is inhibitors of P-glycoprotein, and also the increased risk of digoxin toxicity causes renal failure. Digoxin inhibits sodium-potassium ATPase. Digoxin increases intracellular sodium. Digoxin reduces expulsion of calcium from cell. Increased calcium inside myocyte causes increase in cardiac contractility. The drugs which shows inhibition of ribosome is tetracycline, aminoglycoside, chloramphenicol, macrolide. Drugs which inhibits cell wall synthesis is beta-lactam antibiotics. drugs which inhibits folic acid synthesis is sulfonamides, cotrimoxazole. Lidocaine is a local anesthetic. It is having an antiarrhythmic property. Lidocaine suppresses ventricular tachycardia, which is caused by digitalis toxicity. DC cardioversion is used for tachyarrhythmias. Phenytoin, which is an anti-epileptic drug, it is used in the treatment of generalized tonic-clonic seizures, partial seizures, and also phenytoin is used in the treatment of polymorphic ventricular tachycardia due to QT prolongation. Ogesegepent is calcitonin gene-related peptide, that is CGRP. Ogesegepent is CGRP antagonist. It is used in the treatment of migraine. Next is a case. An elderly man with known case of diabetic nephropathy. He has chest discomfort as well as palpitations. On ECG there is tall T waves. Laboratory examination showed increased potassium levels. In this patient, which drug causes shift of potassium back into the cell? That is epinephrine. Here the diagnosis is hyperkalemia and epinephrine causes shift of potassium back into the cell. Contraindication of epinephrine is anesthesia with halothane due to the risk of arrhythmia. Patient receiving beta blockers because of increased BP, we should not give epinephrine. Epinephrine is agonist at alpha 1, beta 1 and beta 2 receptors. Beta actions are mediated through cyclic AMP. Epinephrine is used in anaphylaxis to prolong the action of local anesthetics, and also epinephrine is given in cardiac arrest. Inhalational epinephrine is used as treatment of post-intubation and infectious group. Hyperkalemia, that is increase in potassium more than 5.5 milliequivalents per liter. Treatment of hyperkalemia is by IV infusion of 10 ml of 10% calcium gluconate for 2 to 3 minutes with cardiac monitoring. Next is by IV regular insulin 10 units followed by 50 ml of 50% of dextrose, which helps in shifting plasma potassium into cells. Next is by nebulization with B2 agonist by albuterol or salbutamol. Cation exchange resins, diuretics and dialysis. These all helps to remove excess potassium. Next case is cabergoline. It is used in the treatment of hyperprolactinemia. Cabergoline is dopamine D2 receptor agonist. Next is a patient who had pituitary tumor, had overproduced growth hormone. For pituitary tumor, surgical removal was done. Resection was incomplete. In this patient, first line treatment is octreotide. Octreotide is a synthetic analog of somatostatin. Here the diagnosis is, that means overproduction of growth hormone in the pituitary tumor. The diagnosis is acromegaly. We give first line drug as octreotide. Side effect of octreotide is steatorrhea, gallstones due to biliary stasis, hyperglycemia. Octreotide is given as treatment in acromegaly. Octreotide is given for dumping syndrome in post-gastric surgical patients. Octreotide is given in secretory diarrhea associated with AIDS, carcinoid and cancer chemotherapy. Octreotide is given in bleeding esophageal varices, which decreases hepatic blood flow and helps to stop bleeding. Next is leuprolide. Leuprolide is a long-acting GnRH agonist. It is used for palliation of carcinoma prostate, uterine fibroids, endometriosis and precocious puberty. Side effect of leuprolide is hot flashes, decreased bone mineral density, vaginal dryness, erectile dysfunction. Next is neferelin. Neferelin is a long-acting GnRH agonist. It is used in the treatment of endometriosis, central precocious puberty and uterine fibroid. Gosrelin is GnRH agonist. It is used in the treatment of endometriosis, DUB, as well as prostate cancer and breast cancer. Next case is middle-aged male patient. He had protrusion of chin, excessive sweating, impaired glucose tolerance, enlargement of hands and feet. Diagnosis is acromegaly. How we treat acromegaly is by giving growth hormone receptor antagonist, that is pegvisomant. And next method is transsphenoidal surgical resection of tumor, and next is octreotide. Acromegaly is commonly caused due to hormone secreting somatotroph adenoma secondary to mutations of pituitary specific gene PIT1. Diagnosis of acromegaly is by serum IGF-1 level, which will be increased, and next is growth hormone suppression test with oral glucose. Prolactin hormone, which affects the lactotroph cell and causes galactorrhea, amenorrhea and infertility. Growth hormone, which affects the somatotroph cells and causes gigantism in children and acromegaly in adults. ACTH affects the corticotroph cells and causes Cushing's disease and Nelson syndrome. TSH affects thyrotroph cells and causes hyperthyroidism. Tests for acromegaly include serum IGF-1 test, which is the single best test. Confirmatory test for acromegaly is growth hormone suppression test. It is 75 gram of oral glucose is given to patient, and then blood growth hormone level is checked at 30 minutes, 60 minutes, 90 minutes and 120 minutes after glucose load. Normally, glucose suppresses growth hormone and it decreases to 1 nanogram per milliliter. If growth hormone more than 1 nanogram per milliliter, it is acromegaly. Next case is diabetic patient presented with rhinitis, facial swelling. On intranasal biopsy, there is broad-based acetate hyphae with branching at right angle. There is complaints of vascular invasion present. Diagnosis is mucormycosis. Drug of choice is amphotericin B. Mucormycosis is seen in patients with diabetes mellitus, diabetic ketoacidosis and invades blood vessels. Most common form of mucormycosis is rhino-orbital cerebral mucormycosis. Diagnosis is by biopsy with histopathological evaluation, which shows wide ribbon-like acetate hyphal elements at right angles. Clinical features include rhinitis, eye or facial pain, facial numbness followed by conjunctival suffusion and swelling along with blurry vision. Treatment of mucormycosis include initiation of treatment by amphotericin B, surgical debridement, reversal of underlying conditions and risk factors, treatment of underlying malignancy. Amphotericin B is a broad-spectrum antifungal drug. It has antiprotozoal action and antifungal property. Amphotericin B is effective against leishmania. Side effects of amphotericin B include azotemia, nephrotoxicity, renal tubular acidosis, infusion-related fever and chills, hypochromic normocytic anemia, infusion-related fever and chills. Amphotericin along with ergosterol in fungal membrane shows pores or channels in fungal cell membrane, which shows loss of membrane integrity and leakage of cytosolic ions. Mucormycosis is a superinfection in COVID-19 patients. Fluconazole is used in the treatment of candidiasis as well as cryptococcosis. Ketoconazole is used in the treatment of dermatophytosis, deep mycosis, but now this ketoconazole is replaced with itraconazole. Griseofulvin is used in the treatment of dermatophytosis. Next case is a TB patient on anti-TB treatment had tingling sensation and paresthesia on lower limbs. Patient is not diabetic, occasionally consumes alcohol. Vitamin given to this patient is vitamin B6. Side effects of isoniazid includes tingling sensation and paresthesia. Isoniazid inhibits the production of mycolic acid. Isoniazid is a bactericidal drug which inhibits tubercle bacilli. Toxicity of isoniazid causes metabolic acidosis as well as seizures. Folate causes megaloblastic anemia. Treatment is by oral dose of 5 to 15 mg folic acid. Vitamin B6 deficiency causes anemia, glossitis, peripheral neuritis, decreased seizures. Treatment is by oral dose of 2 to 5 mg of pyridoxine. Thiamine causes Wernicke's encephalopathy. Treatment of thiamine deficiency is with 200 mg IV thiamine 3 times daily followed by 10 mg per day until complete recovery. Vitamin E results in night blindness as well as xerophthalmia. It is treated with vitamin E given orally 3000 to 5000 IU per day. Side effects of isoniazid includes peripheral neuritis, that is paresthesia, numbness, neuritis, tingling sensation. So isoniazid and pyridoxine 10 mg per day is given to prevent neurotoxicity. Other side effects of isoniazid includes hepatitis, rash, anemia, arthralgia. Next is an elderly patient was given Botox injection for the treatment of wrinkles. Botulinum toxin inhibits the release of acetylcholine into synaptic cleft. Botulinum toxin cleaves snare protein which is involved in exocytosis of acetylcholine, thus inhibits acetylcholine release. Botulinum toxin is used in the treatment of age-related facial wrinkles, blepharospasm, spastic cerebral palsy, post-stroke spasticity. Side effects of incorrect injection includes ptosis, diplopia, muscle weakness, respiratory paralysis, dry mouth, diplopia. Botulinum toxin is an exotoxin produced by Clostridium botulinum, which is responsible for type of food poisoning known as botulism. Evolocumab is monoclonal antibody against PCSK9. PCSK9 is proprotein convertase subtilisin or kexin type 9. PCSK9 inhibitor helps in the downregulation of LDL receptors in the liver. Evolocumab increases LDL cholesterol clearance by liver. Evolocumab is used in patients with atherosclerotic cardiovascular disease to decrease LDL levels. Side effect of PCSK9 inhibitor is injection site reactions, UTI, URTI. PCSK9 inhibitor do not increase the risk of myopathy. Ezetimibe inhibits cholesterol absorption by enterocytes in small intestine. Bempedoic acid inhibits adenosine triphosphate citrate lyase. Decreased LDL is seen in patients not responding to statin treatment. Next is clofibrate. Clofibrate along with PPAR alpha causes fatty acid oxidation as well as increased LPL synthesis. Clofibrate causes myopathy when clofibrate and statins are given together. Clofibrate associated with increased gallstone formation. Next case is an elderly man has rigidity, tremors. On examination, blank facial expressions are seen. Diagnosis is Parkinson's disease. Clinical feature include rigidity and tremors. Treatment includes selagiline. Selagiline is a MAO inhibitor. Selagiline increases dopamine level in brain. Selagiline is used as adjuvant to levodopa in Parkinson's disease. Side effects of selagiline include postural hypotension, nausea, confusion, psychosis, involuntary movements. Selagiline is contraindicated in convulsive disorders. Donepezil is a reversible cholinesterase inhibitor. Donepezil is used in the treatment of Alzheimer's disease. Haloperidol is a typical antipsychotic. Haloperidol is given for Huntington's disease. It is also given for the treatment of acute schizophrenia. Next is a female patient on OCP diagnosed to have TB, started on anti-tubercular therapy, advised to use additional barrier method of contraception. So what is the reason here? Rifampicin induces OCP metabolism and causes failure of contraceptive. Rifampicin is a potent cytochrome P450 enzyme inducer. Enzyme inducers include carbamazepine, chronic alcoholism, cigarette smoking, rifampicin, phenytoin, barbiturates. Drugs which inhibit CYP450 isoenzyme are azole antifungals, chloramphenicol, omeprazole, cimetidine, ciprofloxacin, metronidazole, SSRI, macrolide antibiotics. Next case is 35-year-old chronic hypertensive patient came to OP for preconceptional counseling. Antihypertensives she should discontinue is ACE inhibitors because ACE inhibitors can cause hypoplasia of organs, growth retardation as well as fetal loss. ACE inhibitors can cause oligohydramnios, fetal growth retardation and hypoplasia of lungs and kidneys. Antihypertensives avoided in pregnancy are ACE inhibitors, ARBs, diuretics, non-selective beta blockers and sodium nitroprusside. Sodium nitroprusside is contraindicated in eclampsia. Antihypertensive drugs that can be used in pregnancy are labetalol, nifedipine, metildopa, hydralazine. Pregnant women on indomethacin. The effects of indomethacin on fetus include premature closure of ductus arteriosus in premature infants. Indomethacin is given as IV route. Side effects of indomethacin include renal toxicity in neonates. Indomethacin is a non-selective COX inhibitor. It is an anti-inflammatory, antipyretic analgesic. Indomethacin is used for rheumatoid arthritis, gouty arthritis, osteoarthritis as well as ankylosing spondylitis. Side effects of indomethacin include frontal headache, acute pancreatitis, hepatitis. Prostaglandin analogues helps in the maintenance of patency of ductus arteriosus. Mannitol infusion is given for acute congestive glaucoma. Open angle glaucoma with bronchial asthma we give latanoprost. Latanoprost is a PGF2 alpha analog. There will be no bronchospasm. So latanoprost can be given in asthmatic patients. Prostaglandin analog is the first choice of drugs for open angle glaucoma. Mechanism of action of latanoprost is it decreases intraocular pressure by altering ciliary muscle tension, improving the outflow of aqueous humor. Advantage of latanoprost include good efficacy, once daily application and prevention of systemic side effects. Disadvantage is high cost. Side effects of latanoprost includes blurring of vision, iris pigmentation, macular edema especially in aphakic patients and thickening and darkening of eyelashes. Timolol is a non-selective beta blocker topically in glaucoma. Timolol can cause bronchospasm in COPD and asthmatic patients. Gemiprost is PGEI analog. It is used in the termination of early pregnancy. Nifedipine is a calcium channel blocker. Side effect of nifedipine is headache, flushing and dizziness. Atenolol is beta-1 selective antagonist. Common side effect of atenolol is bradycardia, fatigue, cold extremities. Clonidine is alpha-2 adrenergic agonist. Side effect is dry mouth, sedation. Patient on aspirin has occult blood in stool. It is due to inhibition of thromboxane by aspirin. Thromboxane E2 is an inducer of platelet aggregation. Thromboxane E2 is a potent vasoconstrictor. Aspirin is a non-competitive irreversible inhibitor of COX enzyme. Aspirin is a non-selective COX inhibitor. Aspirin inhibits both COX-1 and COX-2. Anti-inflammatory dose of aspirin, that is 3 to 5 gram per day, causes salicylism, which presents as dizziness, vertigo, hyperventilation as well as reversible loss of vision and hearing. Drugs that increase trabecular outflow are pilocarpine, epinephrine, bimatoprost. Pilocarpine causes myotics. Drugs which increase uveoscleral outflow are latanoprost, apraclonidin, brimonidin, epinephrine. Drugs that decrease aqueous production are acetazolamide, dorzolamide, clonidin, brimonidin, epinephrine, beta blockers. Hyperosmotic agents include glycerol, mannitol, urea. As a medical practitioner in India, alprazolam 0.5 mg daily before bedtime for 7 days is given. A patient on antihypertensive has edema over lips and face. This is drug-induced angioedema. Here we give lisinopril. Calcium as well as vitamin D supplementation decreases bone turnover as well as increases bone mineral density. 1200 mg per day of calcium is given to adults more than 50 years of age. Oral vitamin D3 is given along with oral calcium. Vitamin D supplementation causes intestinal calcium absorption, decreases bone remodeling, increases bone mineral density. Vitamin D is given as 400 to 800 IU per day. Next case is a patient with history of multiple vomiting was given an IV drug which later caused abnormal movements, so patient was given benzhexol. The development of abnormal movements after antiemetic injection is because of metoclopramide. Because of metoclopramide only patient presented with abnormal movements. Metoclopramide is dopamine receptor antagonist. It is a prokinetic. It is antiemetic agent. It causes extrapyramidal side effects as well as dystonia. Anticholinergics like benzhexol is used in the treatment of side effects. Benzhexol is a centrally acting anticholinergic agent. Side effect of benzhexol is galactorrhea by dopamine antagonism. Next case is 60-year-old post-menopausal female patient with previous history of Colles fracture, complaints of low backache, T-score is -2.5, osteoporotic fractures are present. Teriparatide can be given before bisphosphonates. Bisphosphonates have an anti-resorptive action. It has direct inhibitory effect on osteoclast. Bisphosphonates helps in the osteoclast apoptosis as well as prevention of hydroxyapatite dissolution. Long-term bisphosphonate is given for osteoporosis. It is given for about 3 to 5 year duration. Next is teriparatide. It is recombinant PTH analog that has anabolic effect on bone homeostasis by increasing osteoblastic activity. Teriparatide is only approved for 2 years of usage. Bisphosphonates are given for a long term, that means for about 3 to 5 year duration. Denosumab is a human monoclonal antibody. Denosumab binds to RANK ligand, that is RANK L. Osteoporosis prevention we give SCRM, that is raloxifene. For neuroleptic malignant syndrome we give dantrolene. Dosing rate of a drug equation is clearance into plasma concentration. CPSS, that is steady state concentration, means dose rate divided by clearance. Dose rate equal to clearance into target plasma concentration. Zero order kinetic of drug means constant amount of drug elimination per unit time. Rate of elimination means independent concentration minus plasma concentration. Clearance is more with low concentration and clearance is less with high concentration. These all are the points favoring zero order kinetic of drug. Half-life is more with high concentration and less with low concentration. Drugs with zero order kinetics include warfarin, alcohol, aspirin, tolbutamide, theophylline, phenytoin. Levodopa and carbidopa are given for the treatment of Parkinsonism. Hyoscine, which is also known as scopolamine, it is a muscarinic receptor antagonist used in treatment of motion sickness as well as vomiting. Cyproheptadine, it is H1 receptor antagonist used in anaphylaxis, allergic rhinitis as well as urticaria. Acute dystonia treatment is diphenhydramine or benztropine. Treatment of akathisia is propranolol, lorazepam, diphenhydramine, benztropine. Treatment of tardive dyskinesia include VMAT2 inhibitors, which include valbenazine as well as deutetrabenazine. Digoxin is derived from digitalis plant. It inhibits sodium-potassium ATPase. Most common cardiac manifestation of digitalis toxicity is atrioventricular junctional rhythm, premature ventricular depolarizations, ventricular tachycardia, second degree AV blockade. Increased risk of digoxin toxicity include hypercalcemia, hypomagnesemia, hypokalemia, hypothyroidism, renal failure. Important points of first order kinetics of drug. Constant fraction of drug eliminated per unit time. Rate of elimination is directly proportional to plasma concentration. Clearance remains constant as well as half-life remains constant. These all are the important features of first order kinetics of drug. Mechanism of action of methotrexate in osteosarcoma is competitive inhibition of DHFR. Methotrexate is anti-metabolite class of anti-cancer drugs. Methotrexate is an folic acid analog that binds to active catalytic site of DHFR. It prevents the formation of THF, that means decreased lymphotoxins as well as decreased polyamines. Methotrexate, there will be mechanism of decreased purine as well as pyrimidine synthesis. Low dose methotrexate is given for the treatment of rheumatic disease due to inhibition of aminoimidazole carboxamide ribonucleotide transformylase, which increases the levels of adenosine, inhibits de novo, that inhibits inflammation as well as purine synthesis. GI effects and hepatotoxicity can be reduced by use of folinic acid or leucovorin. A patient on digoxin, potassium chloride, clarithromycin, atenolol and triamterene. Patient had serum digoxin elevated and also atrial fibrillation with controlled ventricular rate was seen. Diagnosis is digoxin toxicity. Here the patient was on clarithromycin as well as digoxin. So patient can cause digoxin toxicity. P-glycoprotein pump eliminates digoxin. Inhibitors of P-glycoprotein are clarithromycin, erythromycin, amiodarone, verapamil, diltiazem as well as itraconazole. Patient with CKD underwent nephrectomy. Here the patient was given a postoperative analgesic known as acetaminophen. It is safer non-narcotic analgesic which is given to CKD patients. Patient with renal insufficiency had very low urine output, pedal edema, headache, BP was 160 by 90 mmHg. Antihypertensive given was chlorthalidone. In this case, patient had renal insufficiency with no proteinuria. Treatment of hypertension in CKD include ACE inhibitors or ARB. First line drugs in patients with proteinuria are ACE or ARB. Next treatment method is fluid retention or fluid overload. Thiazide diuretics are given for the fluid retention or fluid overload. It includes chlorthalidone as well as hydrochlorothiazide. Use of methotrexate, code is cancer, CANCER. Use of methotrexate include C for Crohn's disease, A for abortion, N for NHL, that is non-Hodgkin's lymphoma, acute lymphocytic leukemia, choriocarcinoma, sarcoma, ectopic pregnancy, rheumatoid arthritis, psoriasis, vasculitis. Alcohol is not consumed by patients with bacterial vaginosis and trichomoniasis on metronidazole. Metronidazole has a disulfiram-like reaction. Disulfiram inhibits aldehyde dehydrogenase activity. It increases the concentration of acetaldehyde in blood. Metronidazole and alcohol forms acetaldehyde poisoning. Acetaldehyde poisoning symptoms are pulsatile headache, vertigo, orthostatic syncope and blurred vision. Metronidazole, tinidazole, sulfonylureas, cefoperazone and alcohol, these all have disulfiram-like reaction. In CKD stages 1 to 3, where GFR is more than or equal to 30 ml per minute, diazides are recommended. In CKD stage 4 to 5, where GFR is less than 30 ml per minute, loop diuretics are given, which include bumetanide furosemide. Aliskiren is direct renin inhibitor which lowers BP and reduces albumin in urine. Interleukin 6 actions are T cell activation, acute phase protein synthesis, as well as stimulation of inflammatory process in rheumatoid arthritis. Interleukin 2 receptor inhibitors is used as immunosuppressive agents following renal and heart transplants. Interleukin 2 receptor inhibitors include daclizumab as well as basiliximab. Interleukin 4 receptor inhibitor includes dupilumab. It decreases asthma exacerbations. Interleukin 5 inhibitor include mepolizumab, reslizumab, benralizumab. Interleukin 5 inhibitor decrease asthma exacerbation. 6-mercaptopurine inhibits the DNA synthesis. Mitomycin is an alkylating agent. It cross-links DNA. Mitomycin generates free radicals and damage DNA. Actinomycin blocks transcription. Actinomycin has single-strand breaks in DNA. L-asparaginase interferes with protein synthesis. Prazosin is selective alpha-1 antagonist. Side effect of prazosin is headache. Amlodipine is calcium channel blocker. Side effect of amlodipine is peripheral edema. Interleukin 6 is inhibited by tocilizumab. Tocilizumab is a newer humanized antibody. Tocilizumab inhibits interleukin 6 mediated signaling. Use of tocilizumab is used in juvenile idiopathic arthritis as well as rheumatoid arthritis. Erythromycin inhibits CYP1A2 which reduces clearance of theophylline. Chloroquine is an anti-malarial drug deposited in cornea and causes corneal opacity. Chloroquine causes ocular toxicity. Short-term treatment with chloroquine causes blurring of vision as well as diplopia. Long-term treatment with chloroquine causes optic atrophy, keratopathy as well as pigmentary retinopathy. Hydroxychloroquine lowers ocular toxicity compared to chloroquine. Drugs which causes corneal opacity are amiodarone, phenothiazine, indomethacin, chloroquine. Long-term treatment with these drugs cause word-like opacity in the corneal epithelium causing cornea verticillata. It is also seen in Fabry's disease. Etidronate is first-generation bisphosphonate. Alendronate, pamidronate, these both are second-generation bisphosphonate. Risedronate and zolidronate, these both are third-generation bisphosphonates. Patient on lithium therapy developed hypertension. He was started on thiazides for hypertension. After few days, he had coarse tremors and also symptoms suggestive of lithium toxicity, which explains likely mechanism. Thiazides increase tubular resorption of lithium. Thiazide use causes sodium loss compensated in few days by increased reabsorption of sodium in proximal tubule. Thiazide, there is a increase in reabsorption of lithium. Therapeutic purpose, treatment of acute mania, we use lithium, that is 0.8 to 1.2 milli equivalents per liter. For prophylaxis, lithium is used to relapse of bipolar disease as 0.5 to 0.8 milli equivalents per liter. Toxic levels of lithium more than or equal to 1.5 milli equivalents per liter lithium is lost. Erythromycin should not be prescribed with theophylline. Theophylline is metabolized by CYP1A2 in the liver. Bisphosphonates is used as first-line treatment of postmenopausal osteoporosis. Bisphosphonates inhibits bone resorption. Patient with diabetes mellitus and COPD developed post-operative urinary retention. Short-term treatment we give is tamsulosin. Tamsulosin is used in the treatment of benign prostatic hypertrophy. Bethanechol can cause bronchoconstriction in patients with COPD. Terazosin is alpha-1 receptor antagonist used in the treatment of BPH. Methacholine acts on bronchial smooth muscle. Promethazine is used in the treatment of motion sickness. Promethazine is a central anticholinergic activity antiemetic action. Diphenyl methane is not prokinetic agent. Diphenyl methane, its derivative is bis-accodyl, which is used as laxative. Prokinetic agents are drugs which increase GI motility. Prokinetic agents include metoclopramide, domperidone, cisapride, motilin. Patient with antipsychotic drug consuming, he developed Parkinsonism. Treatment is trihexyphenidyl. Trihexyphenidyl drug is a drug given for drug-induced Parkinsonism. It is a central anticholinergic drug. Amiodarone is contraindicated in patients with interstitial lung disease. Most serious side effect during chronic amiodarone therapy is pulmonary fibrosis. Risk factors for amiodarone usage is underlying lung disease. That means dose of 400 mg per day or more of amiodarone can cause pneumonia. Amiodarone class 3 is antiarrhythmic drug. Side effect of amiodarone includes pulmonary fibrosis, hypotension, torsades de pointes, corneal microdeposits. Ranolazine inhibits late sodium current in the heart. Ranolazine is used in the prophylaxis of angina. Serum sodium should be checked in lithium toxicity. Serum potassium should be checked in digoxin toxicity. Mechanism of resistance by lactamases to beta-lactam antibiotics causes degradation of antibiotics. Resistance to penicillin and other beta-lactam antibiotics is due to inactivation of antibiotic by lactamases, modification of target BPPs, that is penicillin binding proteins. That means there is inactivation of antibiotic by lactamases as well as modification of target penicillin binding proteins. And thirdly, impaired penetration of drug to target BPPs and antibiotic efflux. These all are the reasons for the resistance to penicillin as well as other beta-lactam antibiotics. During fasting or dehydration along with sodium reabsorption in renal tubules, there is increase in reabsorption of lithium which causes lithium toxicity. Lithium normal range is 0.8 to 1.2 milliequivalents per liter. Intoxication severity is like in case of mild intoxication of lithium, that is from 1.5 to 2.5, patient has tremor as well as fatigue. In moderate intoxication of lithium, that means in between 2.5 to 3.5, patient will be having confusion, delirium, tachycardia and hypertonia. In severe intoxication of lithium, lithium will be more than 3.5, patient presents with seizures as well as hyperthermia. Other side effects are mental confusion, hypothyroidism, edema, nephrogenic diabetes insipidus. Lithium toxicity is treated with hemodialysis. Decreased potassium causes increased risk of digoxin toxicity. Pegloticase is used in the treatment of chronic gout, that means severe gout or refractory chronic gout. Pegloticase is pegylated uricase, that is urate oxidase. Pegloticase catalyzes the enzymatic oxidation of uric acid into allantoin. A female patient with first-line pharmacological treatment for bipolar disease for 6 months, she is fasting for few days due to religious reasons and seizures, caused tremors, confusion and weakness of limbs were present in that patient. Serum lithium level were checked. There was lithium toxicity in that patient. Lithium is a mood stabilizer. It has narrow therapeutic index. Lithium is the first line of treatment in bipolar disease. Kidney handles lithium and sodium via ENaC channel. 5-fluorouracil inhibits thymidylate synthesis. Novobiacin is a potent inhibitor of bacterial DNA gyrase. Nitrofurantoin is highly reactive intermediates that causes DNA damage. P-floxacin is metabolized in liver, hence avoided in liver disease. Rifampicin inhibits RNA synthesis. It helps in the production of beta subunit of DNA-dependent RNA polymerase to form stable drug enzyme complex. Theophylline causes diuresis by adenosine antagonism. Diuretic effect of theophylline is due to blockade of adenosine receptors. Theophylline is a methyl xanthine drug. Phosphodiesterase enzyme. It includes phosphodiesterase 3 inhibitor as well as phosphodiesterase 4 inhibitor. Phosphodiesterase 3 inhibitor helps in the relaxation of bronchial smooth muscles. Phosphodiesterase 4 inhibitor inhibits the release of cytokines and chemokines, which decrease immune cell migration and activation. Activating enzyme histone deacetylase 2 helps in anti-inflammatory action. Blockade of adenosine receptor prevents bronchoconstriction. Blockade of A1 receptors in the PCT and glomerular afferent arteriole causes diuresis. Potency is the amount of drug to produce given response. Efficacy is the maximum effect produced by drug which reflects the capacity of a drug to activate a receptor as well as to produce response. Log dose response curve is perpendicular height equal to drug efficacy. Efficacy in the above graph shows drug A equal to B more than C. The graph is like it shows the relationship between log dose response of the three drugs A, B and C. In the graph A, B and C, this relationship between log dose and response of the drugs A, B and C shows that drug A has highest potency. Highly potent drug given response at lower concentration and low potent drug shows response at high concentration. More the curve on left side in dose response curve, greater is its potency. Patient having biliary colic in turn gave analgesic followed by pain got aggravated. Morphine is the reason for this. Morphine causes constriction of sphincter of OD, which causes increase in fluid pressure in CBD and gallbladder. Pethidine causes lesser spasm of sphincter of OD. Pethidine is used for biliary colic. Voriconazole is not effective against mucormycosis. Mucormycosis is treated by amphotericin B. Posaconazole is also used for mucormycosis. Voriconazole is the drug of choice for treatment for aspergillosis. Gout is a metabolic disease associated with hyperuricemia. Patient diagnosed with autosomal dominant polycystic kidney disease was prescribed tolvaptan. After few weeks, patient presented with dry mouth and increased thirst. Likely cause is increased free water clearance, which causes dehydration. Tolvaptan is a vasopressin V2 receptor antagonist. It helps in decreased binding of vasopressin to VT receptor in kidney. Lowers the adenylyl cyclase activity, which reduces intracellular cyclic AMP and prevents the fusion of aquaporin 2. It increases urine water excretion and decrease urine osmolality. Side effects of tolvaptan include dehydration, hypernatremia, hypovolemia, liver injury. Tolvaptan delay disease progression in patients with autosomal dominant polycystic kidney disease. Patient with gout develops hypertension, uric acid level is increased. Hydrochlorothiazide is not given to this patient. Drugs precipitating gout are cyclosporin or cancer drugs, aspirin, that is low dose aspirin, niacin, thiazide, Lasix, that is a furosemide, ethambutol, alcohol, pyrazinamide. All these are the drugs precipitating gout. Anti-glaucoma medication unsafe in infant is brimonidine. Brimonidine is alpha-2 agonist which can cross blood-brain barrier. Brimonidine causes CNS depression and apnea in neonates. Apparent volume of distribution of drug is very high. It is 6 liter per kg. Distribution of drug is sequestered in body tissues. Apparent volume of distribution is imaginary volume in which drug is distributed if plasma concentration remains constant. VD is dose administered IV by plasma concentration. Phase of clinical trial is also known as efficacy trial, which is phase 2. Phase 2 consists of small group of patients, that is around 50 to 500, to obtain proof of concept as well as dose ranging study. Efficacy and appropriate dose range is the main aim of phase 2 of clinical trial. Phase 2 is known as pivotal studies. It is of treatment benefits. Phase 1 is done in human for human pharmacology and safety. Patient number is around 10 to 100. Phase 2 patient number is around 5 to 500, first done in patient, and it is done for therapeutic exploration and dose ranging. Phase 3 is patient number is 500 to 3000. It is done as a multi-site trial. It is done for therapeutic confirmation or comparison. Phase 4 is done in a large population as post-marketing, surveillance or studies. Rivaroxaban is oral factor 10A inhibitor. Rivaroxaban do not require monitoring. Oral direct factor 10A inhibitor are indicated in venous thromboembolic disease, post-operative thromboprophylaxis in patients undergoing hip and knee arthroplasty, as well as oral direct factor 10A inhibitor is indicated in inhibition of embolic stroke in patients with atrial fibrillation without valvular heart disease. Factor 12 is Hegeman factor. Factor 9 is known as Christmas factor. Argatroban is parenteral monovalent direct thrombin inhibitor. Oral direct thrombin inhibitor is dabigatran. Indirect thrombin inhibitors include low molecular weight heparin, which includes enoxaparin as well as dalteparin. Indirect factor 10A inhibitor includes fondaparinux. Oral direct factor 10A inhibitor include rivaroxaban, apixaban, edoxaban, betrixaban. Drug of choice for diphtheria carrier state is erythromycin for 7 days. Carboprost is 15-methyl synthetic derivative of PGF2 alpha. Carboprost is abortifacient. Carboprost is given for refractory PPH. Dinoprost is a natural PGF2 alpha preparation. Oseltamivir and zanamivir, these both are neuraminidase inhibitors. Mechanism of action of oseltamivir and zanamivir is competitively and reversibly interact with enzyme. Oseltamivir dose is 75 mg 101 into 5 days, and oseltamivir is used in the treatment of influenza A and B. For prophylaxis, 75 mg once daily is given and continued for duration of exposure. Misoprostol is synthetic PGE1 analog. Gemiprost is synthetic PGE1 analog. Ranolazine is a late sodium channel blocker. Fasudil is Rho kinase inhibitor. Trimetazidine is P-FOX inhibitor. Ivabradine inhibits funny currents in SA node. Nicorandil causes activation of potassium ATP channels, which causes hyperpolarization of smooth muscle cells resulting in vasodilation. Nicorandil is a nitrate-like cyclic GMP-dependent action. Most effective anti-emetic for chemotherapy-induced vomiting is granisetron. Granisetron is 5-HT3 receptor antagonist. Palonosetron is second generation 5-HT3 antagonist. It is a longest acting drug because it delays emesis associated with chemotherapy. Palonosetron has highest affinity for 5-HT3 receptors. Palonosetron has maximum potency. Palonosetron has minimal or no propensity to cause QT interval prolongation. Teglutide binds to enteric neurons and endocrine cells, stimulating the release of insulin-like growth factor, which stimulates mucosal epithelial growth and enhances fluid absorption. Teduglutide can cause bowel cancer, which is not recommended with active malignancies. Teduglutide is GLP-2 analog. It is used in treatment of short bowel syndrome. T-half is 1 to 2 hours. It is given as subcutaneous route once daily. Cis-atracurium is preferred over atracurium because it causes less release of histamine. Cis-atracurium has lower onset of action. Both atracurium and cis-atracurium has similar duration of action and cardiac action. Colchicine inhibits polymerization of microtubules by binding to tubulin. Colchicine inhibits neutrophil recruitment, that is granulocyte. Colchicine is used in the treatment for gout as well as Mediterranean fever. Levofloxacin along with ofloxacin, these both are fluoroquinolones which has maximum bioavailability. It is given as IV and oral route. Triazole's mechanism of action is inhibition of ergosterol synthesis. Azole group inhibits fungal cytochrome P450 enzyme, which leads to impairment of conversion of lanosterol to ergosterol, which results in depletion of membrane ergosterol. Azole group is also known as 14-alpha-sterol demethylase. Dermatologists prescribe acitretin to patients with psoriasis because it is contraindicated in patients with hyperlipidemia. Acitretin can cause increased sensitivity to sunlight. Acitretin has half-life of 50 hours. Female patients should avoid conception for 3 years after discontinuing acitretin treatment to inhibit or prevent retinoin-induced embryopathy. Edrophonium is the drug used to differentiate myasthenia gravis from cholinergic crisis. The test used is edrophonium test. Clinical feature is muscle weakness. IV injection of edrophonium causes muscular weakness in a patient with myasthenia gravis. Acitretin causes cutaneous manifestations of psoriasis. Female patients should avoid conception for 1 month after discontinuation of isotretinoin. Cilastatin is a reversible inhibitor of dehydropeptidase to inhibit or prevent breakdown and prolong the action of imipenem. Cilastatin is used to prolong the action of imipenem. Imipenem is rapidly hydrolyzed by enzyme renal dehydropeptidase. Pegylated filgrastim should not be administered in sickle cell patients because it can cause sickle cell crisis. Filgrastim is treated patients with radiation-induced myelosuppression. Filgrastim we give recombinant human G-CSF as subcutaneous or slow IV. Indications of recombinant G-CSF are severe congenital neutropenia, that means patients with AIDS receiving zidovudin, severe neutropenia after high-dose cancer chemotherapy, as well as severe neutropenia after autologous hematopoietic stem cell transplantation. In all these conditions, we give recombinant G-CSF. Imipenem is also known as carbapenems. It increases the risk of seizures. Exacerbation of imipenem is mainly renal and dosage modification needed to avoid seizures in renal failure patients. PGE1 is patency of ductus arteriosus. It is given in neonates. Indomethacin and ibuprofen are NSAIDs used for closing ductus arteriosus in premature infants and neonates. Best approach for the treatment of chronic SIADH is tolvaptan. Tolvaptan is selective V2 receptor antagonist. It increases urinary water excretion by blocking antidiuretic effect of AVP. Other treatment options for chronic SIADH is demeclocycline, fludrocortisone, fluid intake less than 500 ml per day. Increased thirst is important characteristic feature of hyponatremia in SIADH. Serum sodium levels are corrected by Vaptans. IV mannitol is used in glaucoma. Other uses of mannitol are: it is used in diagnosis of bronchial hyperreactivity as inhalation, Antihemolytic urological irrigation during transurethral procedures. Mannitol is also used to reduce cerebral edema and intracranial pressure. Lebezolid is an example of bacteriostatic drug. Primary bacteriostatic drugs are sulfonamides, erythromycin, tetracycline, linezolid, ethambutol, clindamycin, chloramphenicol. Primary bactericidal drugs are penicillin, cephalosporin, aminoglycoside, vancomycin, polypeptide, ciprofloxacin, rifampicin, pyrazinamide, isoniazid, cotrimoxazole, and metronidazole. Antiviral drug has dual antiviral activity against HIV and HBV. Emtricitabine is a nucleoside reverse transcriptase inhibitor, similar to lamivudine. It has activity against HIV-1, HIV-2, and hepatitis B virus. Colonoscopy done in an elderly patient showed brownish pigmented lesions which had Moire pattern. Diagnosis is melanosis coli. He was admitted to chronic laxative abuse like Senna as well as Cascara sagrada. Bis-acodile is implicated in causing melanosis coli. Patient on treatment for angina presents with erectile dysfunction. You decide against prescribing sildenafil because patient is treated with nitrates for angina. Sildenafil and nitrates are dangerous, causing severe hypotension. Combination of two drugs, that is sildenafil as well as nitrates, has synergistic action on intracellular cyclic GMP levels, which results in uninhibited vasodilation, which precipitates fall in BP. Sacubitril plus valsartan. These both are given as 1:1 ratio, which is used in the treatment of chronic heart failure. Coagulation profile monitoring is needed in therapy with lepirudin because it is a direct irreversible thrombin inhibitor. Most common side effect of lepirudin is bleeding. Enoxaparin, fondaparinux, dabigatran. All these three do not bind to endothelium or many plasma proteins. Antihypertensive not used in pregnancy is propranolol. Propranolol is non-selective beta blocker. It is not safe in pregnancy. Antihypertensives avoided in pregnancy are ACE inhibitors, ARBs, diuretics, non-selective beta blockers, nitroprazide. Antihypertensives safe in pregnancy are methyl-dopa, hydralazine, dihydropyridine, calcium channel blockers. Replacement dose of hydrocortisone for chronic adrenal insufficiency is 20 mg per day. Doxycycline is the drug of choice for scrub typhus. Doxycycline allergic or in pregnancy, we give azithromycin, chloramphenicol or rifampin. Quinidin associated with QT prolongation causes torsades de pointes. It is a life-threatening form of polymorphic ventricular tachycardia. Sacubitril is a new drug for congestive cardiac failure. Mechanism of action of sacubitril is neutral endopeptidase or neprilysin inhibitor. Sacubitril helps in the degradation of atrial and brain natriuretic peptide which lowers BP. Drug used for refractory intractile rheumatic chorea is sodium valproate. Small changes in pH near pKa of drug can cause large variation in the degree of ionization. Corticosteroid is indicated for stimulation of fetal lung maturation in preterm labor, which is beta-methasone. Dexamethasone is another long-acting glucocorticoid which causes less risk of intraventricular hemorrhage. Site of action of amphotericin B in fungi is cell membrane. Amphotericin B binds to ergosterol in cell membrane of fungi and forms pores or channels, which leads to loss of integrity of cell membrane and causes fungicidal effects. Strontium ranelate is reserved for severe osteoporosis. Strontium ranelate acts by causing both decreased bone resorption and increased bone formation. Ibandronate decreases bone resorption only. Ibandronate is a bisphosphonate. Calcitonin reduces bone resorption. Atypical antipsychotic has highest risk of galactorrhea. Atypical antipsychotic includes risperidone as well as paliperidone. Side effect of atypical antipsychotic is due to higher D2 blocking potency. Weight gain is the highest risk of clozapine as well as olanzapine. Least potential weight gain is by aripiprazole as well as haloperidol. Decrease in BP, highest potential is by chlorpromazine as well as clozapine. Decreased BP, that is hypotension, least potential is haloperidol as well as aripiprazole. pH means pKa of drug. Concentration of drug is 50% ionic and 50% non-ionic. pKa is pH at which drug exists as 50% ionized, that is hydrophilic, as well as baki remaining 50% non-ionized, that is lipophilic. Metyrapone is used to test the hypothalamic pituitary feedback pathway in diagnosis of Cushing syndrome. Peptic ulcer disease, it is treated with pyranzepine. Pyranzepine is a selective M1 anticholinergic drug. Pyranzepine is given for gastric ulcers. Pyranzepine decreases gastric acid secretions that have little effect on salivation or heart rate. Piperacillin tazobactam is effective against an organism producing extended spectrum beta lactamases. Extended spectrum beta lactamases produced by bacteria causes resistance to penicillins, cephalosporins as well as monobactams. Extended spectrum beta lactamases produced by bacteria causes resistance to third and fourth generation cephalosporins. Extended spectrum beta lactamases inhibits by combining beta lactamase inhibitors like clavulanic acid or tazobactam. Carbapenems as well as quinolones, these both inherent activity against extended spectrum beta lactamases. Metyrapone inhibits the synthesis of glucocorticoids by inhibiting steroid 11 beta hydroxylase reversibly. Sydenham's chorea is involuntary, purposeless, jerky movements that affects head and upper limbs. Tongue shows visible darting movements. Medications to treat Sydenham chorea is in mild cases we should provide calm environment. In severe cases, dopamine antagonist like haloperidol and pimozide is given. Antileptic medications like sodium valproate and carbamazepine is also given. Next is basiliximab. It is interleukin-2 receptor antagonist. Basiliximab is anti-CD25 monoclonal antibody. Basiliximab has short plasma half-life of 1 week. Basiliximab is used to inhibit transplant rejection reactions. Side effect of basiliximab is anaphylactic reactions as well as opportunistic infections. Mechanism of action of colchicine is colchicine binds to tubulin and inhibits granulocyte migration. Colchicine inhibits polymerization and tubule into microtubules needed for leukocyte migration and phagocytosis. Inhibition of microtubule formation inhibits granulocyte migration, which arrests the cell division at G1 phase. Prasugrel, it is a prodrug. Prasugrel is an irreversible ADP antagonist. Prasugrel is converted into its active metabolite by CYP3A4 and CYP2B6. Prasugrel is more potent than clopidogrel. Prasugrel has rapid onset of action because of better absorption. Apixaban belongs to factor 10A inhibitor. Apixaban is a novel oral anticoagulant. Apixaban is used in treatment of venous thromboembolism as well as DVT. Isosorbide dinitrate is indicated for congestive cardiac failure in combination with hydralazine, which is a direct vasodilator. Hydralazine reduces nitrate tolerance.